The health and safety of all of our residents, but particularly those residents of the Life Care Center in Kirkland today, are our highest priorities. All of those involved in this effort, from nurses on the front line to public health officials and our public health staff at the State Department of Health, at King County Public Health, at the Centers for Disease Control. All of those crafting and implementing new policies and procedures are marshaling every ounce of our resources to fight this outbreak. Here are the numbers as I understand them from this morning. There are 69 residents at Life Care Center. 15 have been transported over the last 24 hours to hospitals, those in need of hospital care. Among the agencies that are on the ground and working there are the Centers for Disease Control, the State Department of Health, and other state agencies, the City of Kirkland, King County Public Health, King County Emergency Management, and of course, the Life Care Corporation itself. I've collected as much information as I can from among these sources. Now, as a reminder, Life Care residents need 24-hour skilled nursing care. They are there because they require the high level of care that's provided by this kind of a facility. And each individual has a unique health profile as well as a unique family support network. At this moment, the situation is extremely fluid, but this is what we know. All residents and staff of Life Care are either being tested, that is to say they've got tests back, or they've provided samples that are being tested, or they will be tested shortly thanks to the University of Washington's increased testing capacity that's coming online. We've been waiting for an increase of testing capacity in our community. It has been a tremendous strain for public health to have to triage those tests. Now we're going to have enough tests to make sure everyone there is tested and to make sure that others, healthcare professionals who are working throughout the community, are tested. All residents who need to be hospitalized have been or are in the process of being transported to a hospital. If someone's condition worsens, they will also be transported. I'll remind you that if someone is infected with COVID-19, not only do they need to go to a hospital that is adequate for treating all of their underlying medical conditions, but also one where they are not going to be in a position to infect others. And some of our hospitals are having to change their procedures or the mechanics of their facilities in order to accomplish that. If family members want to take their loved one home, and some family members of those at Life Care have expressed that, we are working with the state to set up a system with an expert to help them that will provide the support they need to be able to do that. As I say, many of these residents have medical conditions that would not allow them under any circumstance to be able to be cared for in a home, but some of them are able to go home if we're providing them enough equipment and support. So we're working with the state of Washington to make that possible. With the assistance of the state and the Centers for Disease Control and Prevention, new protocols and equipment, Public Health believes that the facility has significantly improved. We've gotten good reviews from physicians from outside who've come in and seen the care that's taking place at Life Care right now, and I want to commend those medical professionals who are on the ground at Life Care working under very adverse conditions. And that this is, for many of the residents, the best place that they can be, those who are asymptomatic but have these health conditions that have to be attended to in a 24-hour care facility. Some observers have wondered why the facility hasn't simply been shut down and evacuated. Well, beyond the reason I just explained, that it provides this unique care that many of them need, there's also no capacity at hospitals or nursing homes to take them. So the governor mentioned this, and I really want to emphasize it. In addition to the resources already at the Life Care Center, a health and medical task force, or the governor did not mention that, he mentioned that we're setting up with the state EOC an incident command structure, rather, to oversee nursing home staffing, family-based care, personal protection equipment distribution, and communication with families, among other needs. So the state of Washington has, within emergency management, incident command centers. They're subject matter based. And today the governor has agreed to set up one that covers nursing homes. So it would focus on life care and any other nursing home where there was an outbreak. They're able to come in with an expert team, provide the work directly with the staff to make sure they have appropriate staffing levels, with the families to make sure they have the adequate equipment and supplies. This is very important. Local public health agency, even a big and robust one like King County's, if there's a hot spot here and then one there and then one there, people's attention is being appropriately drawn to those and away from the community-wide public health work we need to be doing to keep everyone safe across a population of 2.25 million people. So the state's role in really taking on these hot spots and helping us to make sure they're adequately resourced and staffed is tremendously important and very much appreciated. Now, what I was getting to before is the federal government is stepping up through the budget, but also, very importantly, through a task force of 30 medical professionals who are going to be landing on the ground tomorrow to go to the Life Care Center and to help provide the service that a very strained staff there very much needs. That's from the United States Public Health Service. And we are grateful that the cavalry is arriving. It is going to make really rapid change, I think, in the conditions there. The state and the county are working with families to tailor solutions that will work for each of them, and none of us could help but be moved by the very real plight of those who are having trouble communicating through Life Care with their relatives who are in the facility, who are wondering about their condition, who are asking whether they need to be moved to a hospital or whether they can come home with them. That challenge is going to be met, and we are not going to allow that kind of situation to occur as we put these other federal and state resources in place occur in the future. I'm going to be talking with the state and other providers and others across the nation about how we address this issue moving forward. And it will be key to slowing the spread of the virus and keeping people, particularly those in vulnerable populations, healthy. For the families who say they are not being adequately communicated with, we hear you. With this state and federal help, and I hope with the continuing cooperation of the Life Care Corporation out of Tennessee, we want to change that. We want to make sure everyone has the information they need and the support they need in this time of crisis. But know this, these families are top of mind. These residents are top of mind. We are 100% committed to the health and welfare of your loved ones. We must prepare this region for the inevitable continued spread of this virus, at least in the short run. But we will do everything we can to slow its spread, to protect those who are most likely to become seriously ill from it, and to keep the entire community safe and fully informed.